Whoa. Tell me I'm not about to hear that a dentist did your breast augmentation.
He did.
Good morning.
Hello.
Nice to see you again. Yeah, we met last year. I was a white girl with blonde hair. I changed meanwhile from a white woman to a black woman to an African woman.
By the way, just say it.
What?
Paul is completely dumbfounded. I'm used to him being dumb, but not so dumbfounded.
This is no fake. It's a new medicine. No, it's not. No, this is not.
This is real. This is Melanotan.
No, it's not.
Well, it's a relative of that. It's an MSH stimulator.
You actually just change your You're serious.
Anyway, it's great to see you. Let's talk. Have a seat. Let's talk about this.
Thanks.
Is this amazing?
The doctors are very professional, but to shock Dr. Nassif so, it is a sign that Martina's change is really hard.
You had... Are you okay? Can you handle this?
Hold on. Did you really? This is real?
This is real.
There's actually... Hold on.
This is real pigment. They injected this in you, yes?
Yeah, in the belly.
They gave you an injection.
In the belly.
One injection?
3.
So you've had 3 treatments.
Yep.
I had the same treatment, but for me it don't work so well. It's still in approval. It's
So it's in a testing phase.
yes.
These drugs have been around for years. You inject it, it stimulates MSH, melanocyte stimulating hormone, to increase melanin production from melanocytes. When you inject melanotan into the body, it stimulates all the pigment-producing cells in your body, wherever they are, in your eyes, your skin, your hair, to produce more dark pigment. So the drug I'm familiar with, in this country, it's illegal. You can't even experiment with it. These drugs are very dangerous. Have you had any side effects?
No.
Did you throw up?
It didn't.
Do you have any joint pain? Pain in your...
No.
No pain?
Was this one of the complications described that you would go this dark?
Her melanocytes are turned on. They're upregulated.
Okay, but are they going to downregulate or is this sitting there?
No, this is reversible, right?
Because the drug is new, he can't say the exactly period how long it works.
But I won't go again because I like it.
It's not a complication. I don't think I'm going to wake up and going, oh, now I need to go back very soon. No, I'm going to stay black.
How long have you guys been together?
2 years almost.
Yeah, I told him right from the beginning that I was very fascinated by big boob and, you know, long blonde hair and everything like that. And he was like, all right, well...
I can live with that.
Yeah, I'm saying,
I was actually really goth when I met him. Yeah, I just started 1 year ago to transform myself. It's called bimbofication.
Bimbofication.
Yeah.
So when we hear the word bimbo, we think of someone who just is very stupid.
I don't want to be an airhead, but basically what it is to look like a male fantasy, like, you know, have a bit of a blow doll look. I want to look like a doll, but I don't want to be a doll. And I know that is very contradictory, but I feel like my body is a form of art.
You consider yourself a himbo to a certain degree, don't you? He starts by shaving his back. And then he does various procedures to himself to enhance what's lacking, if you know what I mean.
Terry, yes, I know I'm handsome, but I have brains. I'm not a himbo.
Tell us about the plastic surgery you've had.
A year ago, I enlarged my boob from nothing to 650 cc's. I got infection, which now the right boob is much harder than the other one.
What other things are on your list that you're thinking about doing?
A Brazilian butt lift and rib removal as well to, you know, smaller the waist.
Okay, what
else?
else?
I like an internal corset to always make the waist line slim and bigger boobs. At one point, I even thought about, you know, sewing my fingers together because that would create like a doll hand. I don't know how that will work.
Yeah, no.
Hello, Dr. Nassif, Dr. Dubrow, Poppy, Sarah, and Tony.
How are you?
Good, thank you.
Nice to meet you.
Having a 10-year-old in with the parent to talk about possible plastic surgery procedures is at best unorthodox and at worst very weird. How are you?
Please,
Terry
have a
Dubrow.
seat.
Pleasure to meet you.
Hi.
Please.
I've heard all good things about you.
You see me, not you.
No, both of you. Dr. Dubrow and Dr. Nassif totally fascinate me. And although I'm here on holiday, I want to see what they've got to offer in relation to hand jobs. Buy one, get one free, face, hands, Bob's your uncle.
So we know a bit about your situation, but if you wouldn't mind telling us your involvement in the plastic surgery world.
Okay. 23 years ago, I was brutally attacked. I was considered a good-looking girl. I was one of Hugh Hefner's Playboy Bunny girls back in the day, and I got involved with this maniac who ended up robbing me of my looks, basically. So I ended up being patched up, put back together. They saved my life, but not my looks. I decided to go back to school, and then I became a practitioner of aesthetics by trade myself. So I then became a walking advert on Harley Street for the plastic surgeons who finally rebuilt me. Wow. So they gave me cheek implants, chin implants, and eyes and nose, everything. Bob's your uncle, here I am today.
I love that expression, by the way. Sarah really is like a walking billboard for the surgeons that have done plastic surgery on her, and she actually looks pretty good.
Let me ask you something.
Uh-huh.
A couple years ago, I remember what happened in the media when you gave your 15-year-old daughter Botox.
Oh, that story.
And that caused a huge uproar out here.
Oh, yes.
I don't know about England, I'm sure it did too.
I divided a nation.
Yeah, we obviously are against that. You know, a 15-year-old girl doesn't need Botox.
She was a professional dancer. She suffers with hyperhidrosis. So it was nothing to do with anything cosmetic. It was purely a medical procedure.
There wasn't a picture of you, like, putting a needle right here?
I got stitched up by one of the leading tabloids. They said, oh, because you're a nurse and you've got injectable fillers here, can you just pose for a photograph? It sealed my fate with that story. I was naive. This was years ago, but I have learned a lot since then.
Take us back, tell us the journey, and how did you arrive here?
I get into fitness modeling because I fit the criteria, but I noticed girls that had bigger breasts were getting more gigs. So I'm like, okay. One of my model friends referred me to a guy. Her breasts look awesome.
A guy?
Yeah. Well, I mean, he was a dentist, but I thought he was a doctor.
Wait. Whoa. Tell me I'm not about to hear that a dentist did your breast augmentation.
He did. He didn't represent himself as a dentist.
Okay, so what happened? You went in there, and what was the interaction like?
He's like, oh, I'm gonna give you a 475 or 450, a big C, a small D.
Okay.
About a year and a half later, I go back. I want them a little bigger and kind of closer together.
That doesn't work, by the way. Going larger never makes breasts look closer together. All it does is make them look bigger. And until plastic surgeons figure that out, we're gonna see a lot of big-breasted girls who are very far apart. How much bigger?
550 or so.
So nothing changed, really?
No. So then...
Tell me you didn't go back to the dentist asking for bigger ones.
I did not, because he told me he wouldn't do any more. Okay,
Okay.
I find this guy, do some research, and I tell him I'm okay with the size, you know. I just want them closer together.
Okay.
I wake up, and my boobs are, like, real huge. And they were like, oh, well, we put 1,000 cc's in.
You woke up with 1,000 cc's in each breast, almost double in each
And no
breast.
closer.
No. And then he said, oh, I took them from under the muscle.
Wait, he took them from under the muscle to on top of the muscle?
Yeah.
Why?
He said because the envelope or something was too small. I was like, okay. And I started getting rippling, and like the implant did backflips inside my boobs.
Oh, really?
Yes. One nipple's here, the other one's like, you know.
Some are breasts. Some are here, some are there.
Yeah.
Tia's surgeon put her on top of the muscle. Why? It's a lot easier surgery. It's a surgery that you can learn in a weekend course. That's why a lot of cosmetic surgeons do it. But at the end of the day, there's a reason we put patients under the muscle, and that's to provide more muscle coverage, prevent this exact problem that Tia has, and it also overall just looks a lot better. So what procedures have you had?
I've had 13 surgeries.
Oh my God.
In what period of time?
And I was so pretty before, but I'm just more elegant now. Almost a year.
Were you put under anesthesia 13 times in the last year?
No, 3.
Oh, okay, so multiple operations done at once.
Correct.
In plastic surgery, sometimes we do multiple procedures. Now, they may be small, but you can have up to 5 or 6 procedures at one time, as long as it's safe.
Why are you so serious like that? That is so funny.
Well, as I'm pondering this conversation for a minute of trying to figure out, why would you want to do that much of a transformation that quick?
Are you married?
No.
You're single.
I was married for like 10 years, but
Oh, really?
no, I'm single.
How long after you broke up did you start having these surgeries?
Oh, like 4 to 5 months.
It is very common for people after a traumatic event or a breakup to come in and want to have plastic surgery, but you have to be very careful in those individuals that they're doing it for the right reasons and that they don't have unrealistic expectations. That can be a real red flag.
Hello, my name's Jordan and I'm from England and I am addicted to lip filler. I've had filler in my chin, both lips, both cheeks, smile lines on my forehead, and I've had Botox here. Yeah, I can't really move. Can't really move my face. When I got my first procedure, I was 19. I got my eyebrows tattooed on. I had to get them tattooed on a regular basis, you know, to keep up with it. I was 21 when I got my lips done. I went in there and I was like, you know, you need to make me look natural. I want just a little bit of definition. And they just got bigger and bigger. And I sort of got addicted to the lip filler. And then I was shopping with a friend and a guy turned around and said to his friend, oh my God, they're lips. And I was just like, oh my God. But I kind of love that because any attention is good attention, whether you're thinking bad things, you're still thinking about me. And it was more attention from guys, so yeah, I love that too. After all the attention I got, it slowly like got more and more. I used to go to the doctor and I'd get 1 mil, then it was 2 mil. And then it just got to the point where I found a doctor and I was just like, you know what? Just give me it all. Sometimes like filler can leak out of the sides. It's quite scary. It's like they need fixing because I'm worried that if they keep leaking, I'm gonna end up with small lips again and that wouldn't be me. Like I just think like my lips has really changed me as a person and I'd be like so normal and boring without them. That's the look you wanna go for. Good luck with that. But I would not like to walk into a room and people like not notice me, whereas my lips walk into the room and people are just like, oh my God, I want to get to know him. I hope the doctors can like really help me just stop them from leaking.